afternoon. Thank you for joining us today. We'll be talking about your infant's oral health. Just want to take a moment to apologize for our technical difficulties, so thank you for staying on. Before we get started, I would just like to mention that we are not wearing masks because we are divided by a barrier in following all COVID-19 protocols. My name is Shannon, and I'm a registered dental hygienist here at the Niagara Region Public Health, and I've been a dental hygienist for the past 11 years.
Hello everyone, my name is Christina, and I'm also a registered dental hygienist here at the Niagara Region and have been a hygienist for 11 years. If you have any questions during our presentation, feel free to add them into the chat box. We'll try our very best to answer them at the end of our presentation.
Baby teeth are important because they help with chewing, speaking, and smiling, as well as they hold place for the permanent or adult teeth. Baby's teeth can get cavities, which is tooth decay, dental pain, and dental infection, which can affect their mood, appetite, sleeping patterns, and can cause trouble with speech. If your child has cavities in their baby teeth, they are at an increased risk of having cavities in their adult teeth or permanent teeth.
Cleaning your child's mouth should begin at birth to the first tooth using a damp cloth or a finger cloth like this one I have here today. From the first tooth to the age 3, teeth should be brushed by an adult using an infant-sized toothbrush and using a finger cloth like this. Using a rice grain-sized amount of fluoridated toothpaste should also be applied twice daily.
Teething is a natural process where the teeth cut through the gums in a row. Teething usually starts around 6 months and continues to the age of 3. Your child will start teething again at 6 years of age when the 6-year molars start to erupt, as well as 12 years of age when the 12-year molars erupt, and 17 to 21 when the wisdom teeth start to erupt. The first teeth to appear are usually the 2 bottom front teeth, followed by the 2 upper front teeth. And remember, this is just a guideline. Every child develops at a different rate.
There are many signs of teething, such as minor discomfort, drooling, red cheeks, swollen red gums, the need to chew on things, and irritability. Please never ignore fevers. Fevers, stuffiness, diarrhea, and runny nose should not be blamed for teething. Contact your doctor if your child has a fever.
If your little one is experiencing teething pain, try gently rubbing their gums with a clean finger. You can also use a firm teething ring, but never frozen, as a frozen teething ring can damage their gums. You could ask your dentist, pharmacist, or their doctor if they can suggest over-the-counter medicine to ease the pain. If your baby is on liquid medication, usually sweetened for taste, rinse or wipe the mouth with water immediately after the medication is given, as the sugars in the medication can cause cavities.
Painkillers that can be rubbed on the gums, such as over-the-counter tooth gels, should be avoided because the numbing agent can affect the child's throat, causing a difficulty swallowing. Food and fruit in the baby feeders for a long feeding time can cause an increased risk of cavities due to the natural sugars in the fruit. Amber necklaces should also be avoided as they pose a choking hazard. Teething baby biscuits have added sugars or contain hidden sugars, which can also cause cavities. There are many teething rings that are plastic and fluid-filled. They may crack open or break when being chewed on, resulting in getting into the baby's mouth.
If your baby uses a pacifier or a soother, it is a better substitute to thumb sucking because thumb sucking affects the development of teeth, the roof of the mouth, and jaw, and is a hard habit to break. If you give your little one a soother, check the packaging that makes sure on the label it says orthodontic design and ensure that it is a non-toxic material. Always make sure the soother is clean before giving it to your little one, and never use a sweetened pacifier, so we don't recommend dipping it in anything such as honey, sugar, or syrup, as this may lead to cavities. And never clean the pacifier with your milk before giving it to the little one, as this may cause cavities-causing bacteria to them.
We also don't recommend using anything in the bottle other than milk or water. Please don't mix any sweetened items such as honey, syrup, or artificial sweeteners to the bottle. Absolutely no juice and no diluting any beverages as well. At bedtime, we only recommend water, as milk in the bottle at night can pool in the baby's mouth, forming cavities. If having milk, we do recommend wiping the child's mouth afterwards or rinse with water. If your child is struggling with just plain water, try adding things such as pepper or lemons.
So your child's first dental visit, we recommend establishing a dental home for all children between 6 months months to 12 months of age or when they get their first tooth. Tell your dentist or your dental professional if there are any dental concerns for your baby or child, including accidents, falls, chipped teeth, discoloration, bleeding gums, or pain. As Niagara Region does not add fluoride to tap water, we recommend a professionally applied fluoride varnish application twice a year. Fluoride is naturally occurring mineral that can be found in water, plants, rocks, soil, air, and even in most foods. Fluoride works by strengthening or remineralizing the outer layer of the teeth called tooth enamel to prevent cavities from starting, to reduce the size and number of cavities, and even to lessen tooth sensitivity. Fluoride varnish can be painted on your baby's teeth from the time that they get their first tooth, much like nail polish is painted on the fingernails. Since it is applied directly to the tooth surface, the amount of fluoride that is absorbed or swallowed is minimal and is equal to brushing with fluoride toothpaste.
There are many free services that we offer children under the age of 17 in our community for dental services, such as assessments, cleaning, fluoride, and sealants. There are different locations throughout the Niagara region, such as Welland, Niagara Falls, and Thorold. We also do have our mobile dental clinic that travels throughout the region, providing service.
If you have any questions right now, please feel free to drop them into our chat box. If you have any questions following this presentation, you can contact us Monday to Friday, 8:30 to 4:30. We have our live chat feature on our Niagara Region webpage, as well as you can call the dental helpline or send us an email that should be appearing on the screen now.
We did have a few questions come in, so we will start with Casey. Casey asks, how often should you be brushing your 2-year-old's teeth? Once a day or twice a day? So Casey, we would recommend that you should be brushing your 2-year-old's teeth twice a day using a rice grain size of toothpaste every morning and every night.
Awesome. So the next question we received was from Beverly, and they asked, when should I introduce a flosser to my kids? So we recommend flossing, or there's really a need to floss the teeth when the teeth start to touch. But we do recommend introducing the floss as soon as they have teeth, even if there's a space just to encourage the habit of flossing. And the second portion of our question was, when should they go to the dentist for the first time? So again, as we mentioned previously, between 6 to 12 months of age or when the child gets their first tooth.
The next question came in from Amber. Amber asks, should I be cleaning my 9-month-old teeth after every bottle, or just brushing their teeth every morning, night? Do night feeds contribute to early tooth decay? So the first part of that question, Amber, we would say we do recommend brushing your child's teeth every morning and every night. During the day, if they're having a bottle, we would recommend using a finger cloth or a damp cloth to clean the mouth out. We also don't recommend having anything in the bottle at night, as cooling in the mouth causes early childhood decay.
We just got another question here from Donna, and she asked, what toothpaste do you recommend for 9 months? So again, in Niagara, we don't add fluoride to the tap water, so we recommend using a fluoridated toothpaste of your choice. And again, for a child 0 to 3 years, a rice grain amount size and 3+ pea size amount of toothpaste. So again, twice a day, morning and night. This kind of leads into our next question, kind of perfectly actually. It was asking, we have another question come in that asks, do you have any positions to hold your child or baby when brushing or wiping their teeth? We recommend always supervise your child on the change table, but we recommend brushing your teeth on the change table. Again, always supervise. You can have your toothbrush or finger cotton toothpaste stored nearby. And I find that the baby, they're kind of the perfect laid back position to access their teeth. As well, you could, what I utilize with my kids, I have a 2-year-old and a 5-year-old at home. I sit on the floor and I have my son or daughter lay their head back, resting on my thigh, which is a good kind of way to access their teeth. If you have a child who might be a little bit stubborn like mine, you can take one of your legs and gently kind of rest over their arms or shoulders, just kind of keeping them in place. As well, you might find another great technique for brushing is wrapping your child in a blanket or towel just so their arms are kind of nice and snug to their body, making you a little bit better access if your child is kind of thinking when it comes to toothbrushing, which I think most children are.
We did have a question about why are there gaps or spaces between my baby's teeth? So these spaces are there as they are good space holders because the adult teeth coming in are larger. So it is nice to see some space between the baby teeth. They will fill in from the adult teeth. Having said that, all children are different. Not all children have spaces between their teeth.
We just had another great question roll in from Sarah. She says, my children hate the taste of minty toothpaste, and so do mine, actually at home. They refuse to use it, and are there alternatives? Yes, so my children too hate the taste of minty toothpaste. They claim that it is spicy, which for the little taste buds I can imagine it could be. There are great alternatives. I have found a strawberry flavored toothpaste, I believe made by Crest, but again, here at Public Health, we just recommend fluoridated toothpaste. And you may have to use some starchy, but there are some great alternatives, strawberry flavored, that I have found and that both my children do enjoy using. Just another moment as we have another set of questions kind of coming in here. It's Amber asked, do I rinse my infant's milk out after I brush their teeth? And you want to know what? You can or you don't have to. So if your child is 0 to 3 years old, we recommend a rice grain amount size, and it's such a small amount of toothpaste that if they were to swallow, it's not a concern. So if your child is able to spit, that's great, but that's why we recommend waiting to 3 to introduce the pea-sized amount of toothpaste, so when you are able to spit, introduce more fluoride in the toothpaste. Hopefully that answers your question, Amber. Just looking over some more of our questions that we have coming in. We have another question from Jenny Rose. They ask, Christina and Shannon, how to maintain a 3 to 4 month old baby infant oral health? So as we kind of mentioned before, every child develops differently. So 3 to 4, I'm assuming they don't have any teeth at this point, at 3 to 4 months old. Let me just double check, at 3 to 4 months, not 3 to 4 years of age. 3 to 4 month old. So at this point, again, we're recommending using a finger cot or a damp cloth and wiping the milk out after every week if possible. If that's not possible, because honest to God, at some days you're going to have great parenting moments where you're getting the toothbrush in there or the finger cot or cloth. Other days you may not be able to do that. So we recommend trying to do that in the morning and at night, and giving it kind of your best effort. And not to worry too much, because you can always book an appointment with us or your dentist. We recommend once every 6 months. And that way, if you have any dental concerns, if you're not getting the brushing or often enough, and you have a concern, you can address it with the dentist or hygienist. And hopefully we'll get kind of your child on kind of a right trajectory to good oral health.
A few more minutes here, just some questions rolling in.
We do have one more question here. My baby's teeth are growing and crooked. What should I do? So a great thing about baby's teeth is that's not an indicator of the adult teeth. So it doesn't necessarily mean the adult teeth will grow and crooked. So it's not too much of a concern. The only difficulty it may pose if you see it crowding, it might be difficult to get the toothbrush in there to remove the plaque or glue that may be stuck. So again, just try your best morning and night using the appropriate sized amount of toothpaste according to how old your child is. But again, if you have any concerns, come to see us. We're here. We can apply a fluoride varnish to kind of help ease any kind of concerns that you are having. If you're having difficulty with brushing any kind of crowded or crooked teeth. Just want to give one more moment to make sure we kind of reach and touch base on everything. We have another question that's come in. When should I introduce toothpaste with fluoride?
So like Shannon said before, we do recommend fluoridated toothpaste at all ages in the Niagara region here. Do not have fluoride in our water. Fluoride at a young age helps prevent cavities. If you have any questions or concerns with cavities, please don't hesitate to come to us here at the Niagara region.
All right, that's fantastic. That seems like all of our questions that we received. If you have anything else, you can give us a call at our dental program or dental line. Thank you for joining us today. And again, if you have any further questions, please contact the dental program. So bye for now and have a great weekend.